Hello, Lisa Broyles here with Way to Health MD, and I wanted to give you a brief update today on two very popular drugs, Ozempic, which is also known as Wegovy or Rybelsus, and its close newer cousin, which is tirzepatide, commonly known as Mounjaro. So I wanted to talk about these two drugs. They are both what are called GLP-1 inhibitors. They work for people with type 2 diabetes to help regulate their diabetes. And you've probably heard of them because of their massive, impressive results with weight loss. So when these drugs initially came out, I was very hesitant to use them or recommend them because they do have some significant side effects that we'll talk about here in a minute. However, I can't deny the incredible weight loss benefit. I have patients that have lost as much as 60, even 100 pounds on these products. So clearly there is a benefit. There are some risks. So should you be on Ozempic, which is semaglutide, for weight loss or for your diabetes? That depends. The Ozempic, which is semaglutide, is cheaper than its newer cousin tirzepatide, which is Mounjaro. However, the Ozempic has a little bit more side effects than its close cousin, Mounjaro. The most common side effect is something called gastroparesis. So basically, if you are chronically constipated or you have a history of pancreatitis, then this drug is not for you. If you take it, you very likely will experience nausea, vomiting, even worse, constipation. And believe me, the vomiting can be so severe that it's not controlled by routine medications that are commonly prescribed, such as Zofran. So the other category of patients is patients with a family history or personal history of something called medullary thyroid cancer. This is relatively rare. However, these medications, at least in animal models, have shown an increase in thyroid cancer being on these medications. So other side effects that aren't really talked about that I am noticing is hair loss. I am seeing patients starting to lose hair, often women that are perimenopausal, postmenopausal, and just starting to get that hair back with some good progesterone. And then they take Ozempic or tirzepatide, which is the Mounjaro, and they start the hair loss all over again. Unfortunately, this is a side effect of the drug. There's been a mixed reports of brain fog and fatigue. I can't verify that, but there have been some case studies. I haven't seen any literature proving that, nor is it listed as a side effect. So your insurance will cover being on these medications if you are a type 2 diabetic or if you are obese. Many people that actually would benefit from these drugs do not qualify via insurance and need to pay cash. So a lot of providers, including myself, are starting to offer the weekly sub-Q injections of Mounjaro or Ozempic through other clinics. I have Center of Balance Clinic in Saluda, North Carolina with Dr. Lauren Pilgrim, naturopath, offering now Ozempic or the Mounjaro. Also Fortify Wellness Clinic in Columbus, North Carolina under Maria Pellegrino. We will be offering weight loss programs for both of these drugs, but I want to keep my patients from being on them forever because the studies are showing when patients stop them, they gain the weight back. And that's because these drugs make you not hungry. So they inhibit the hormone that tells your brain it's hungry, and because it slows the gastric emptying, you feel full faster. So this is the primary way that people lose weight, is because they're simply not hungry. So you have to develop strategies while you're on these drugs to help you to lose weight and keep losing weight once you stop them. Ideally, I don't want you on these medications for longer than 6 months so that you don't develop the hair loss, the brain fog, the Ozempic face where you lose your facial fat and your skin gets more saggy. I'd love for you to avoid these side effects. So if you're not having the gastrointestinal effects, let's work together for 6 months to make sure that your diet and your lifestyle reflect a healthy, low-calorie, but healthy, rich in vegetables and protein diet that will help you sustain the weight loss when you stop these medications. So I hope that's answered some questions about these commonly prescribed medications. And my answer to whether or not these drugs are safe is it depends. It should be individualized just like everything else I do. Thank you.